Injecting Anesthesia for an Upper Blepharoplasty. Athré Facial Aesthetics, performed by Dr. Raghu Athre. Most upper blepharoplasties are performed under local anesthesia. This video shows the appropriate technique in order to anesthetize the upper eyelid. The patient is awake during this procedure. As you can see, the upper eyelid has already been marked out and is being injected with 1% lidocaine with 1 to 100,000 epinephrine. A 30 gauge by 1/2 inch needle is being utilized. Small aliquots of local anesthesia are being injected immediately below the level of the skin. If you look closely, you can see a slight blanch to the skin. Furthermore, at the periphery of the visual field, you can see the assistant slowly tapping on the patient's forehead. This creates a distraction technique to further make this process more comfortable. The medial portion of the incision is the most tender area. Once the entire incision has been injected, approximately 2 minutes are allowed to elapse prior to commencing the surgery. For more information, please look at our website, www.athrefacialplastics.com. Thank you.